there, this is Sujata Martin, pelvic floor therapist and certified birth doula, and today I'm going to show you how to use a birth ball, exercise ball, yoga ball, whatever you call it, for getting some hip strengthening and hip flexibility during pregnancy. So, okay, let's start off what we shouldn't be doing. Now, people think that with these balls, because they bounce, you want to be bouncing up and down. This is good core exercise if you're not pregnant and not carrying 10 to 12 pounds of extra weight in your core, because then that weight is slamming down on your pelvic floor. Not so great, right? So do not do the bouncing, not super great. It just adds undue stress on your spine and on your pelvic floor. We don't want that. So what you can do is, first of all, I highly recommend some upper body strengthening, because no matter how you feed baby afterwards, if you're breastfeeding, if you're bottle feeding, moms spend a lot of time hunched over like that, and it creates a lot of neck and shoulder pain. It creates the slouching in the back. So during pregnancy, I very strongly recommend working on some nice opening and strengthening exercises for your shoulders and upper spine. Before we get to that, how do you choose a good ball? Now, with a good therapy ball that is right for you, I'm going to turn sideways so you can see. You want your hips to be higher than your knees. Now, this ball is slightly flattened out, so my hips and knees are on the same level, which is okay. This may actually be good. As you can see, this is squishy, so a little squishiness or less air in the ball may be a good thing if you're first starting out using this, if you're not so confident, because it's going to be more stable. It's going to be it's going to have less movement, and you probably be less nervous about sitting with a big belly on this ball because it is more stable. Ideally, if you feel confident on the ball, if you have good balance, good coordination, then you ideally want your hips to be slightly higher than your knees, so not so squished down. So right now I'm at the same level, which is okay, but ideally we want it slightly higher, especially if you're using it postpartum also as an exercise tool. So we found a good ball for us. Now what do we do? So sit on the ball when you're doing your upper body exercises. Like I said, upper body strengthening is great for pregnant moms, great for postpartum moms. So work on this. It's good for your back. If you work in an office at a desk job and you sit for a long time, this is a good variation in your sitting position. Again, to keep a strong core, keep your hips flexible, things like that. That being said, don't sit for 8 hours on this ball. You're going to get tired and miserable and achy. Movement breaks, variation is what our body craves. So sit on this for an hour or two, and then switch back to standing or sitting as you usually do when you work, but a good variability. Okay, so that's how you use it for positioning. And how do we move for strength and for flexibility using the ball? So you can start with some basic side-to-side movements. Now, if you feel unstable initially, pull a chair up, keep that for support. So I'm going to pull up this chair just for demonstration purposes. You can have one hand, you can have the chair in front of you and use both hands. To start with so cradle that belly and just do side to side. Okay, just side to side, and this you can do when you're watching TV, when you are just relaxing after work, before work, whatever floats your boat. So and with this, see how I'm going to end range. Now please don't fall off. Now in pregnancy, we don't want to push our limits. I don't want you falling off of the ball, because that's not fun. But I am going to the end of my comfortable movement to feel some nice stretch on the side of my hip. And then I go on the other side, same thing, nice side to side. I also go front and back, rolling forward, rolling back, and you can even roll back and almost do a cat camel in this, or a cat cow, and feel that nice stretch in my lower back. Again, I am not pregnant. I have good balance right now. I do not need this chair. Please use support so you feel comfortable and safe. So front and back, side to side. Okay, I'm going to move this chair away. The next thing you can do is asymmetrical movements. So you want to plant one knee farther out and with your toes pointing at a 45-degree angle to the corner of the room, and then you rock into that knee. So you want to open up sideways. Open up sideways, just like that. I'm going to back up a tiny bit. Maybe you have a better view of my knees. So yeah, open up sideways and back, sideways and back, and same thing on the other side. Now I am moving to both sides because I don't have a baby between my legs, or between my legs, and I have no pain. I feel good, but based on how your baby is, based on how your pelvis is positioned, you may feel one side more comfortable than the other. Listen to your body, do what is comfortable. We do not want to be in pain just for the purpose of symmetry. Okay, so side to side movements are great. And then something else you can do is hip circles. Again, I would highly recommend using a chair for support or something initially. Plant your knees nice and wide and go as far forward as you can. Gently roll back, going back into it, and then out to the side. And back to the front again, out to the side, and nice and back. Now again, I have good mobility. I don't have a baby, so I can even get that extra spine movement in. This is good postpartum again for lower back pain, just for core strengthening. It's a good easy start, but if you have a baby, just limit your movements to how much you feel comfortable and safe doing. So hip circles. So today we talked about how to measure yourself for a therapy ball or an exercise ball or birth ball, how to get some strengthening in with movements side to side, front and back, asymmetrical movements on the side, and hip circles. We talked about how to use it for positioning if you're at work to get some variation in movement during your day. And we talked about what not to do, which is bouncing up and down. If you have any questions, please feel free to reach out. This is Sujata Martin at Concierge Pelvic Floor. I love working with pregnant and postpartum people to help them feel confident and safe as they birth and as they heal postpartum. So hoping you're doing well. All the very best. Bye.